What does a baby amniotic tissue have to do with ED? Well, stay tuned and find out. Ever wonder how amniotic tissue from a baby and how it can affect ED? Well, amniotic tissue is a thin membrane that surrounds the baby in the mother's womb. It is the membrane underneath the fluid. It's a sac, and then amniotic fluid surrounds the baby, and that amniotic tissue is just that thin membrane that is next to the fluid and then is part of the amniotic membrane and placenta. What's so interesting about this tissue is that it is rich in growth factors that help repair tissue, rich in cytokine. Cytokine is a protein that is released from white blood cells, such as monocytes and macrophages, that involve in immune function, and substances that promote tissue repair and regeneration. As you know, ED is due to poor blood flow, that is due to probably inflammation of the endothelium, and therefore you're not getting enough blood flow to the penis, along with other causes such as hormone imbalance and nerve damage, and also psychological factors and lifestyle factors as well. In recent years, there's been recent interest in the use of amniotic tissue to treat ED because amniotic tissue can repair damaged nerve and also blood vessels, and therefore there's speculation that it can help with ED. It can also repair tissue by creating a scaffold. And what's interesting is that the amniotic membrane is very, very porous, meaning it can soak in material and nutrients and growth factors from the surrounding tissue that create a favorable environment for growth of new cells and repair of damaged tissue. In the amniotic tissue, you can find such growth factors such as transforming growth factor beta, TGF hyphen beta, and vascular endothelial growth factor, VEGF, and platelet derived growth factor, PDGF. All these growth factors can help with stimulating the growth of new blood vessels, nerve, and perhaps even smooth muscle in the penis. However, the use of amniotic tissue to treat ED is still very, very new research, and it shows promising, but it can potentially become ineffective and may not be safe at this time. And it's not approved by FDA, and FDA actually consider it a drug. And also know that the amniotic membrane, when it comes from the placenta, right? So after a mother gave birth, the placenta is removed as the afterbirth. And how they get amniotic tissue is that the company get the placenta and then they bring it to the lab and they dry it up, they desiccate, they sterilize it. However, that process of sterilization and processing can actually damage the function of the amniotic membrane because it's outside the body, and cells cannot live long outside the body, and can cell even live in sterilization process and processing. And most of the time the amniotic tissue is delivered in a vial in a desiccated or dry form that needs to be mixed. So the functionality of the amniotic membrane in a vial is questionable, whether there's any live cells in it at all to be effective. In fact, there was a study that was done that had looked at amniotic tissue to see if there's any type of live stem cell in there, and there isn't any live stem cell in the amniotic tissue, according to this research, and I'll put that in the show note. So having said that, yes, a live amniotic tissue that has live tissue may have promising result. However, if it is being processed and sterilized and delivered in a vial, there's questions of whether viability of the tissue and whether any of the growth factors are still in there at this time. So you need to keep that in mind if you are considering getting amniotic tissue. Just know that it's not FDA approved, and that FDA considered it a medication. And in fact, the FDA is investigating some clinics right now that have used amniotic tissue and fluid to treat pain, and they consider it a drug. So it's a very gray area at this time for provider to use this, and also the efficacy and safety is still unknown. To be very wary of this at this time. There were a study that was done in 2015 from researcher in China that showed that amniotic tissue were effective in improving ED in men that were caused by nerve damage. And in 2016 study, a researcher in Turkey found the amniotic tissue graft were effective in improving ED caused by Peyronie's. In 2017, research in the US found that amniotic tissue were effective in improving ED function in men caused by a variety of factors. However, these are clinical trials at this time. It's still being researched. It does show some promise, but more research is needed to confirm these findings and to determine whether amniotic tissue outside of the womb and being processed and desiccated that has any type of live tissue at this time. I do not use amniotic tissue in my clinic to treat ED because of this. I'm waiting for more data and research and to show that these tissue do have live cells as well as a regulatory agency to make sure that it is approved at this time. So, having said that, if you're considering this, make sure that you know what you're getting into. So, having said that, just know that you can lead an ED free life and that you can live more, love more, and be happy. I'll see you in the next episode. Hello there. Want an amazing sex life? This free gift is going to give you more sex by helping you get harder and lasting longer. Let's talk about the most sensitive subject, the effect that aging has on your sex life. If you're over 40, there's about 67% chance that you have to deal with one or more of these issues. You sometimes go soft in the middle of sex. You sometimes have trouble lasting long enough to climax. Your erection just doesn't feel as hard as it used to be, and your penis is not as sensitive as it used to be. You cannot reach orgasm or ejaculate. You sometimes have trouble getting an erection. These things lead to frustration and embarrassment when you cannot please your partner. My name is Dr. Ann Truong, and I've been treating men for issues like this for over 25 years. As a board certified medical doctor who specializes in men's health, I helped over 7,000 men reverse the effect of ED. As a way to introduce you to the ED treatment that I offer, I want to give you the most incredible free gift ever. But don't let the fact that it's free gift fool you. This powerful gift will help you get harder and stay and last longer and may just revolutionize your sex life, making sex more exciting, more thrilling, and an amazing experience again. How is that? So here's what you're going to get in this most incredible free gift. Number one, a good morning wood smoothie recipe. This is my specially formulated antioxidant recipe that will help you get harder and stay and stimulating more blood flow. It is formulated to increase your nitrous oxide level, which is one of the biggest keys to making you harder and firmer more often and will also help you last longer. It is filled with lots of greens that create more nitrous oxide in your blood. This smoothie will give you that morning wood effect and will also make you harder on demand when you need it most. And you'll see the effect in about several weeks. Number two, nitrous oxide testing strip. You will also get two of these strips, which you will use along with simple instructions to test your nitrous oxide level in your saliva. Nitrous oxide is a gas in your body and is required for good blood flow to the organ. The strip can determine if your nitrous oxide are deficient, which can help us advise you on the best way to reverse your ED. Even more important, since ED is an early warning sign of problems with circulation and heart health, this can also be a great way to prevent heart related problems such as strokes and heart attack. Number three, and the best part of all, a 30-day free trial access to the Modern Man Club. as part of our mission to make men hard again, we launched the Modern Man Club as a way to provide education and support to a community of men who's on the path to reversing their ED, with pre-recorded and live session being offered every week. I will help men regain sexual health through training, support. I will be there all the way with you to hold your hand through, so that way you can overcome ED and have your best sex life. Members rave about this session and the sense of community they gain by being a member of the Modern Man Club. And all you have to do is to say maybe to this offer. And once you say maybe, you will be on your way to a more fulfilling and exciting sex life. So all you have to do is fill down the form below, and then I will see you on the inside. Thanks for listening to the Sexual Health for Men podcast. If you love this episode, then please take a screenshot on your phone and post it on Facebook, Instagram, or wherever you post. And be sure to tag me and let me know why you like this episode and what you like to hear in the future. That will help me know what's great for you, and I would love to give you the most incredible free gift designed to help you improve performance quickly. Go to my website at sexualhealthformenpodcast.com to get the book, The 5 Common Costly Mistakes Men Make When Facing ED. I would appreciate it if you subscribe, leave a review on Apple Podcasts or wherever you listen, and just know that you can have sexual vitality for life. I appreciate you. Until next time.